this is one of the best privileges of the weekend. It's been a lot of fun with everybody here, but I get to let you know a little bit about the 2010 Service Award winner. This is an individual who, as much as the TMA is responsible for us all being here, and who is very responsible for me being where I am. So when I was a resident at Johns Hopkins and first met Dr. Douglas Kerr, he was a newly minted attending, bouncing around the wards in search of transverse myelitis everywhere, and under his wing, and teach us about all the nuances of this disease. And Doug has a lot of wonderful qualities. As from a student's perspective, one of the best things is his passion. He is very passionate about everything he does. He's passionate about his research, he's passionate about his care, he's passionate about his family, and he's passionate about his patients. And it is one of the things that inspired me to follow along and take an interest in the disorders that we study. It is a great honor to recognize Dr. Kerr as the 2010 Service Award winner. So we've put together a little, this is your life. No, I'm just kidding. So in high school, his prom date, no. So as I alluded to, there's a lot of aspect to Doug's life. He's been a wonderful clinician, he's been a wonderful teacher, he's been a wonderful researcher, and what we wanted to do tonight was have somebody talk about each of these different qualities about Doug. And so we're gonna pass along the mic. I'm gonna enforce a time limit, Sandy. But we're going to start on the research side, and I was going to ask Dr. Michael Levy to step up and just share a few words.
Hello, everyone. I also owe my career to Doug. I met Doug when I was a resident also. I saw my first case of NMO, and I looked this up on PubMed, and I saw, wow, there's an antibody, and I looked around Hopkins, and I found Doug, and I said, Doug, I have a case of NMO. And he's like, come to the lab, let's figure this out. And that's how my career got started. He's been promoting my career ever since, and basically I owe it all to Doug. But I just want to tell you all about one story on a more personal level. And that is about a year ago, Doug came back to Baltimore, and we all went out to lunch, his family and my family. And my 1-year-old daughter was in her stage where, you know, if she saw a grown man, she would just cling to me. You know, tuck her head inside and just wouldn't have anything to do with strangers. But Doug was different. She saw Doug, and she just started playing around with him right in the middle of the restaurant. They'd go running around each other, and it was really cute. I think his daughters were jealous, but I think that really says something, that my 1-year-old daughter, who wouldn't have anything to do with any other person, just really had a connection with Doug. I think a lot of his patients do. I certainly did, and I think he touches a lot of people. All right. Thanks.
Doug. I first met Doug in 1999 when we invited him to come to the Seattle Symposium. And what an incredible feat that was, because up until 1999, we had nobody that was interested at all in talking about transverse myelitis. Most of us had only heard from most of our doctors, I don't know, there's nothing written, just don't know. Here came Doug to the symposium to talk about transverse myelitis and sit and listen to the number of questions that came from all of us. And I know that there were many times where you were gonna have to say, I don't know, I'm gonna have to get back to y'all on that. But you know, to walk into an event like that and walk away from that with knowing that this was going to be your cause means the world. Yesterday in Sandy's overview, you all saw pictures of Doug, and by all means, Sandy does not follow Doug around the world taking these pictures. When we invite him to a symposium, to camps, he takes the call. He always comes. And many of those times, it's leaving his family behind, which I think, says so much. I believe that you have brought the TMA to a much higher level. Without you, we would not have a TM center. Without you, we would not have the research that has been begun. You've inspired so many other doctors to study transverse myelitis and any other conditions, and most of all, brought over 20 doctors together to create a diagnostic tool that is now being used around the world. Thank you. Many years ago, I decided I needed to come and visit Doug as a patient, and he became one of my many doctors in my life, all the way from Baltimore, communicating with all of my doctors in Seattle, and making big changes in my life. Like mine, I know you've made huge changes in other patients' lives, and we thank you so much for that. Doug, you are a brilliant researcher. You are a compassionate doctor and a person that I can call a true friend. My hope to walk again remains because of your accomplishments and encouragement. I thank you for being you, and I'm so proud and excited that you're receiving this award this year. Chitra.
So I don't know if I can follow that, but I met Doug when I was 23 years old, fresh off the boat from India, and I'd come to do my master's in public health at Hopkins, and he'd advertised a job saying, I need someone to do data entry, $15 an hour. That was a lot of money, because the other 2 jobs I had were $8.50 an hour. So of course I said yes, and I interviewed with Doug, and that's 1999 when I met him. And 2001, when I graduated, he said, come work with me. And I said, I have no interest in clinical medicine or anything like that. I really want to go back to India and work in public health. And he said, no, just give me 2 years. Those 2 years became 12 years or something that I worked for you. And I am who I am today because of him. I think he took somebody who was extremely shy, timid, would never be standing in front of you and talking, would never publish papers or, be able to read an MRI. But I do all that today because of Doug Kerr. And I thank you. And this is a very well-deserved award.
So I never do anything with few words. Pauline and I have pinched each other many times since 1999, just totally incredulous that somebody like Doug came into our lives. It's really hard to express just how much he's changed the lives for people who have transverse myelitis and these other rare neuroimmunologic disorders. A more brilliant researcher, a more compassionate clinician, a more committed educator, and really a more dedicated friend there isn't on the face of the earth. We are a very grassroots organization. I mean, an incredibly grassroots organization. And Doug has made us much more professional, but he's also created something of a family among 8,000 people who depend on him and the other doctors involved in our organization that do all of this incredible work. It is a real honor, and it is a thrill for me to present you the 2010 Transverse Myelitis Association Distinguished Service Award.
I'm shocked by this. This is very surprising to me. I'm deeply grateful. This is a patient community that I first interacted with in 1999 in Seattle. And, you know, Sandy said this yesterday, that I wasn't sure that this was going to be a community that I identified with as really a professional identity. I mean, this was something that I felt like I really needed to change the course of people who have transverse myelitis and what they go through. But it was very clear in Seattle in 1990 that indeed was the case. And so it was great for me to establish the Transverse Myelitis Center, and Chitra really did it. I mean, we all know the truth. And Chitra was the brains behind it and the organization behind it, and really thinking about how we gain some information about transverse myelitis and a variety of disorders in this constellation. And, you know, and Ben and Mike were great, and these were the two guys who really have, I think, expanded this beyond what we thought it would be initially. And so it's been wonderful. I've loved it. I love seeing patients. You all know that I left Johns Hopkins in January, something I thought I would never do. And it was shocking for me to do it, except that I was given an opportunity to study neuromyelitis optica and transverse myelitis, and to develop clinical programs at this company, Biogen. And I was dubious of that. I was dubious that a company would be interested in a rare disorder for which there's not a whole lot of commercial interest. I mean, these are disorders that don't make you a lot of money. And I became convinced throughout last summer and fall that indeed this company was committed to really changing the lives of people, and that I could play a role in that. And I could play a different role than the role that I had been playing for the last 10 years. And that was very exciting to me to do. And so I feel like I'm now playing a similar role. I'm interacting with researchers, I'm interacting with scientists, but I'm still trying to do the same thing, which is to get rid of the suffering and to cure this disorder and to develop new therapies. And so it's a very different feeling to be back here to this symposium, because I didn't organize it. And well, Chitra didn't organize it because she did all the others. But nonetheless, I'm kind of an observer, but I also have a different perspective. And the perspective is, what does it take to get drugs developed for rare diseases? And there is a passionate interest from drug companies in developing therapies for rare disorders. And in part, it's because of the beautiful work that Brian Weinschenker and Dean Wingerchuk have done in identifying what NMO is and to really stratifying what these disorders are. It makes it very attractive. It doesn't have to be a big common disease to be something that we want to develop a therapy for. And so that's where we are. We're really at the brink of being able to develop that for NMO or for transverse myelitis or for optic neuritis. So it's an exciting time because we understand the biology of it, we understand the clinical aspects of it. So I still will contribute. I'm shocked by this, and I'm deeply grateful but angered that you've done all this. So thank you.